is there any possibility that treating it as early as possible does end up, lowering your long-term outcomes or worsened outcomes in the long term?
Yeah, that's a really good question. The way we kind of think about the pathology, the spread of Parkinson's, there's increasing evidence that it starts sort of in the sort of gut, and then
Mhm.
kind of moves through the brainstem and by the time we start seeing hallucinations, we're seeing some spread of the synuclein to the cortical regions. So it does sort of have this sort of progressive nature to it. I think the first symptom is individuals may report oftentimes seeing people or animals or illusions out of the corner of their eyes, often at night, maybe in low light situations or kind of in that sundowning period. So that's often the time we ask folks if they're having those hallucinations. Um, and they may come and go, and they may be related to their dopamine therapies, including most commonly dopamine agonists. So we kind of have to take that into context. Has there been a recent change in their medications? Um, are they on a high dose of dopamine agonists? Is there a urinary tract infection or another infection going on that may be causing these hallucinations to really emerge? Are they dehydrated? Are there other things that may be causing the hallucinations to come? Because in sort of a natural progression, they should start with sort of infrequent uh, occurrences that are not so bothersome. And then as the disease progresses, we tend to see a little bit more of the sort of concerning, scary, very bothersome hallucinations that may prevent people from falling asleep or from relaxing at nighttime. As far as I know, I don't think there's any data that says treating those hallucinations with agents that sort of either block dopamine or block or the pimavanserins that sort of work on serotonin receptors reduces the risk of progression. We're still looking for disease modifying therapies in Parkinson's disease, like in Alzheimer's disease. So I think in general, we want to take a symptom-based approach. Usually, I think I go back to the point of how bothersome are these symptoms to patients, because oftentimes they're not bothersome and they don't need treatment in that case. But if people are being tormented by them, they're not being able to sleep, they're causing behavioral changes. So we have had patients that, because of their hallucinations, are leaving the house, wandering, or doing things that put them at risk. Then those are the sort of symptoms we really want to treat. And I think what you're saying about the having a indicated use, I think pimavanserin, I think is clearly now sort of the first step if it's available. So brand name medication, it's not always available or affordable for each patient. But I think we want to. I think that the data is suggesting that that's the first step now.